everyone, my name is Erica Davis, and this is my final speech video on lobotomies, and here's my audience.
Hello.
Hello.
Alright, so ice picks, the psychosurgery. First done in Portugal by Dr. Anthony Muniz in 1937, he further inspired American physician Dr. Freeman, who went over to do 3,400 patients in his ice cream truck. This procedure was extreme in nature, involving an ice pick, hammer, and chipping away at the frontal lobe of patients' brains. Doctors would administer local anesthesia. If that didn't work, then they would use electrical shock therapy until the patient became unconscious. This would last about 5 minutes before the procedure would begin. So this is the ice pick that would go into the eye socket orbital. And then they would use a hammer here at the end of the eye socket, and they would hammer away until it would go into about 2 inches into the eye socket. And at that point, they would perforate the frontal part of the menses. And this is actually Dr. Freeman here with the patient that he was doing the procedure on. This is also his ice cream truck that they called it back in the day, that he would ride around, and he would actually go to people's houses and perform the surgery at the bedside with 3 or 4 different doctors at once. And this was usually done for patients with any type of disease, from just general anxiety to depression to schizophrenia. They used to treat all types of diseases. It was the new wave back in the day. So everybody was wanting to get the surgery, not really knowing how invasive and barbaric it was. So the doctor would position a sharp steel pick about 7 inches into the eye socket, or longer, with the points underneath the eyelid and against the bone atop the eye socket. Then they would swing a mallet to the butt of the pick, thus driving the point through the pass of the bridge of the nose and into the brain. Once this ice pick was about 2 inches into the brain, the doctor would rotate it, severing the connective white matter between the prefrontal cortex of the brain. The prefrontal area of your brain, where the lobotomies are actually done, is where we do our decision making. It affects our personalities and it controls all of our emotions. So most people, after they got this procedure, were not the same after. The realm that this procedure went on was between 1940 and 1967. There was little known about this procedure before Dr. Freeman even started doing it. And prior to his first patient, he actually had never done the procedure before or even practiced it. So performing this procedure, he did it mostly on schizophrenic patients, but even did it for just housewives that would have depression back in the day. One of the more famous lobotomies that Dr. Freeman did, this is another picture here of the procedure and about how far it goes. This one is a 7-inch needle, and it goes in past the eye socket, and then it hits the brain for about 2 inches behind the front of the brain here. So this is another person that he did. This was a 7-year-old that he did at the time, and this is before and after. This patient still was having disruptive behavior after, and actually couldn't talk after the procedure. And then we go on to Rosemary Kennedy, who, if you guys know the Kennedys, are our famous president. They had so many different stories of crazy stories going on, and Rosemary Kennedy was just one of them. Rosemary Kennedy was an unfortunate example of this barbaric surgery. She was born with developmental issues since birth. When she was actually born, she got stuck in her mother's birth canal because the doctor wasn't ready to deliver her. So they told her to hold the baby inside the birth canal. So this caused her to have several behavioral issues when she was born. She was agitated a lot. They said that she had a little bit of schizophrenia and bipolar, but she was a normal, healthy adult. You see how beautiful she was here. When she turned 23, this was when John F. Kennedy was about to run for election, and he was afraid that Rosemary, her beauty, her strikingness, and her impulsiveness would run off and get pregnant by someone, and he was in fear that, she would ruin the election and campaign. So he let Dr. Freeman do a lobotomy on her. Without telling his wife, because back then you didn't have to have consent by both parents. Only one parent needed consent to have this type of surgery done. She was never the same after this surgery. She lost the use of her arms, legs, and couldn't talk, and attained the mental capacity of a 2-year-old after this. And this is what Rosemary Kennedy looked like for the rest of her life, from after she was 23. She was wheelchair bound. And they actually moved her to upstate New York, where she stayed in a long-term care facility and mental health institution for the rest of her life. This procedure today is not done anymore, obviously, and it actually ended in 1967 when Dr. Freeman did this procedure on someone at home. They ended up hemorrhaging and they died, so they took his license away the same day. And this surgery is rarely done. If so, today it's done in a more angelic manner, and it's usually the last resort to mental health. So, and that is it for my lobotomies. I hope you guys guys enjoyed my
Very
session.
interesting. Great job.
Thank you.
Great information.